Okay, so I'm just going to give a brief overview of what the RadNet grant means. Okay, so as I said, this was a major grant to Manchester University, and in particular to the Christie Trust of £16.5 million over 5 years. So significant advancement to advance radiotherapy research here at the Christie. So we were one of 7 centres of excellence in the UK who were successful in this grant, which is a great advantage because even though our researchers and our students are situated here at the Christie and everything that brings, we also have this national and international network that our students are able to tap into. So a really good support network. And of course, you know, an advantage here at the Christie is that we have the proton beam therapy centre, so lots of opportunities through RadNet with that, and of course the MR Linac machines as well. And really, this is all about helping to bring the next generation of radiotherapy treatments to our patients much sooner and with a much better evidence base. So the aim of this is really to put patients at the centre of our research questions. We want to address research questions that everyday clinicians ask. And of course, in Manchester, we have a unique population of patients that already have many or more than one underlying health condition, so comorbidities, which we need to manage in balance with the treatments that we give, taking into account their underlying conditions and some of the medicines that they're on, and how radiotherapy might interact with those medicines. So here's just an example on this screen of some of the questions that we hope RadNet can help us to address. So they're very much real world questions that we're hoping to address. And you might have some questions on that as we move forward throughout the session. So the vision of RadNet here at the Christie, it sits in the Radiation Research Unit, the RRU, and our vision is to achieve individualised physical, biological targeting of diverse patient cohorts. So that comes into the comorbidity population that we have here at the Christie, using real-time outcomes, and I'm going to touch on that in a few more slides, and a deep mechanistic understanding of immune response, comorbidities, and genomics. So it's pulling all of those together. Our ethos is that every patient counts. So we want to include patients in our research that otherwise actually may not meet inclusion criteria because of comorbidities and other medicine that we're on. So we're very much interested in real world patients that may otherwise be excluded from clinical trials. Our approach is very much team science, so we very much come to our research from a multidisciplinary perspective, because that's the way we treat patients. We work in multidisciplinary teams, multi-professional teams, so why wouldn't our research have that approach as well? And that's really when we get the best outcomes. There's 3 work packages linked with this, and I've already touched on them, but looking at the relationship between radiotherapy and immunotherapy. What's the benefit of that dual therapy? Radiotherapy planning with real world patients. So again, getting back to that unique Manchester population that we have here. And targeting instability and looking at the role of hypoxia. So having said that, we have 4 real strengths here in our Manchester hubs, where radiobiology sciences will be uplifted through protons, biomarkers, so EMC trials, so early cancer medicine trials. We have a very big facility here that looks at early phase clinical trials and looking at that interface with radiotherapy. Clinical informatics, that's where our data sits. And of course, the reason why you're all here on this session is for the Radiographer Academy, which we're really, really excited about. It's certainly the first in the country to take this approach. Okay, so I'm just going to very quickly skip through this because I have already touched on what the 3 different work packages are, and if people have a particular interest in any of those work packages, then we're very happy to take questions at the end of my presentation or throughout the afternoon. So again, it's the work package on the immune consequences of radiotherapy, treating complex comorbid cancer patients, and looking at chromosomal instability. So this is the ethos but behind our academy. I think probably wanting to develop the academy, and probably most of you can recognize that radiographer research has not reached its full potential. Perhaps not enough attention and enough opportunities have been given to the radiotherapy world, and there's a real untapped talent there, which is the whole ethos behind wanting to develop this academy. We want to develop in the UK, branching out from Manchester, a really strong radiographer pool of researchers that we can develop and grow with the science. So our plan is that obviously through the academy is that we will have our masters and PhD fellows, and we already have, as you know, 2 PhDs currently open for applications. And this will very much link into the Christie School of Oncology. So we have a fantastic advantage here at the Christie that we have the only school of oncology that is on site in an oncology cancer hospital. So there'll be lots of opportunities and support for our students to tap into there. And as I've already mentioned, we have specialised services as well, including MR-Linac, protons and brachytherapy. And we really want to start to develop that strong research culture and research ethos. And you can see who the hub leads are there. And I'm delighted to have been asked to be part of one of the hub leads. So this is just reiterating some of what I've just said about the advantages of Manchester University, very closely linked in with the Christie site, which is obviously where our students will be based. You can see we have the front of the hospital pictured there, but if you look up in the top right-hand corner, that's an image of the new Patterson building, which is currently having its foundations laid later this week. And we hope that that building would be finished within the next 2 to 3 years. And it's going to be a very unique cancer research facility that is directly linked to a comprehensive cancer centre, which is the Christie. So what I just want to touch on now is a little bit about the research group that I developed for nurses and allied healthcare professionals. And we've had quite a few radiotherapists and radiographers, diagnostic radiographers come through the Christie Patient-Centred Research Centre, CPCR. And what type of research we do, it's very much about understanding and improving both the patient and family experiences and patient-centered outcomes. And by patient-centered outcomes, I mean quality of life, symptom experience, how people experience and manage short and long-term consequences of both chemotherapy and radiotherapy. So we cover research starting right at cancer prevention through to early detection, whilst people are undergoing treatments, and through to survivorship. And we also do research in palliative care and end-of-life care as well. And it crosses all domains of an individual's life. So CPCR was very enthusiastically launched at the Christie in 2016, having received major significant investment funding from the Christie charity. And I think that's a real strong message that the Christie are really serious about developing their non-medical clinical research. So the launch was very successful. The auditorium was absolutely packed. And so it was a very exciting time. The chief executive turned up a few minutes late and he couldn't find a seat. So you could say that was a mark of success. And we've just grown since then. I had 2 researchers working in the team at that point, and I now have a team of nearly 15. In addition, a number of PhD students and master's students within that as well, across all disciplines. So the idea is that the academy students would also link in very closely with CPCR. And you can see here, this is a diagram of the research strategy at the Christie. And you can see that CPCR, Christie Patient Research Group, is a cross-cutting group that goes across radiotherapy, systemic therapy research, early detection and screening, late toxicities and surgery as well. So I think that's really significant to have this patient-centered research group, which isn't just for nurses and allied healthcare professionals. I also have 2 medical colleagues employed in my team as well, but it really is there to support the clinical academic development for our non-medical workforce. And this is just an example of some of the activities that we do to support not only clinical researchers, but all of our clinical staff working on the wards, outpatient departments, who may just want to, you know, come in and see whether or not research might be something that they want to take on. So we have workshops, writing for publication, drop-in sessions, and we support staff with applications for studentships and to apply for their own research funding as well. We also have a monthly group called Can Do, where all nurses and research get together once a month and we talk about different research activities, and people might present different research that they're working on as well. And they've been really, really popular, and delighted to say, and Cynthia will support this, is that we get a lot of people from diagnostic and radiotherapy coming to these sessions, which is great. So I just want to describe what a clinical academic is, because I think if you're working in a clinical field and you're interested in research, I think we need to move away from, to be able to do your research, you have to go and sit in a university. What the Department of Health and the Christie and the university are really keen to do is to support our clinicians to engage in research and to stay in clinical research and have joint roles, so clinical academics. So you spend some of your time working on research, doing academic work, as well as integrating that with your clinical time. And that would certainly be a pathway that we'd be wanting to support our RadNet Academy students to follow that pathway. But in the UK, across all of our nursing and allied health professional workforce, it's less than 1% of us that are in these clinical academic roles, so way behind our medical colleagues with that. But the aim is that by 2030, the Department of Health want at least 1% of the non-medical workforce to be in these joint roles. So a really exciting opportunity. And this is just an example of some of the people that we have supported at the Christie. And you can see we have Lisa there, radiographer, and Amira and Wes, radiotherapy, for the radiotherapy department here in the Christie, who we've supported with different clinical academic ventures. And I think some of them are on the line today. So I'll have to get post-hoc permission for using your photos, I'm afraid. But you can see there's a range of different sorts of things that we have supported people with there. And I'm just going to finish off with a couple of slides on one project that I'm leading on, but it's a trust-wide project, and it's the implementation of electronic patient reported outcomes. So this is a system where patients can be sitting at home And before they come in for a consultation or to have radiotherapy treatment or a follow-up appointment, they can report on different symptoms that they are experiencing so that they can get more timely care. And when they come for their consultation, the clinician is already aware of what that patient has been experiencing. So just to show you what that looks like, the system that we have at the moment, but we're doing lots of work to develop this further, is the patient would receive a text message 3 days before their outpatient appointment. They'd go through a couple of checks, and then they would get asked a series of questions relating to symptoms specific to the disease cancer group, whether it's lung cancer, head and neck cancer, and also the type of therapy that they're receiving. And then dependent on how the patient responds to those different questions, they will then get an automated alert giving advice as to what they should do. So here's an example for a lung cancer patient, and they would be asked to tick which type of treatment they're in the process of having. And then based on that, they would then receive specific questions relating to their underlying cancer, as well as the treatment pathway that they are on. And then you can see they go through a number of specific questions then, and if they answer yes, then subsequent questions will come up so that they can give more detail as to exactly what they're experiencing with that particular symptom. So there's just another example of asking about anxiety and depression. We also have a question in there about urine in the last 24 hours, and the patient can select what color urine they currently have. And specifically for our head and neck patients, we have specific questions about difficulty swallowing. And again, we've inserted pictures that just comes up on their mobile phone to help them more objectively decide which response best matches their current experience. And we're doing lots of work collecting this real world data to see what benefits it has, although there's a very strong evidence base that doing electronic patient reported outcome measures does improve quality of life and survival. But we're obviously collecting that real world data as we go along. So a really exciting piece of research, and I think from a radiotherapy perspective, you know, real opportunity for us to improve that journey for our patients. So I'm going to stop there. I'm very happy to take questions, or Cynthia, if you're coming back online.
Yeah, thanks, Janelle. That was brilliant. I think what we're going to do, because of the technical glitch, we're already a few minutes behind schedule.
Sorry.
No, that was great, and it was really informative. I put a thing up on the chat. If you have questions for Professor York or any of our next 3 speakers, please put them on the chat, and we'll try and moderate that during our panel discussion time between sessions. So the next group of speakers are 3 established research radiographers with very different backgrounds and who've taken very different pathways to PhDs. And so the first up will be Dr. Helen McNair, who works at the Royal Marsden and the ICR, to tell us a little bit about her pathway to becoming an established researcher in the field.